All right, let's jump right in. Today we're doing a deep dive on body dysmorphic disorder, BDD. And we're going deep, folks, straight into a treatment manual for clinicians. This
Yeah,
is where the real nitty-gritty is, right? Yeah.
absolutely. You know you're getting the real deal with these manuals. We're talking insights straight from the experts on BDD.
And we're going to need that expertise because this isn't just, someone who checks the mirror a little too often.
Not at all. BDD, it's a whole different ballgame. We're talking about a preoccupation with perceived flaws. Flaws in appearance that most people wouldn't even notice.
Yeah, it's way more than just wishing your hair was a bit thicker that day or something like that.
Exactly. It's these fixations,
Mhm.
and they can really take over someone's life. The manual actually gives this example, right, about women with A-cup breasts who are totally fixated, totally distressed about their size.
Wow.
It's a powerful example, I think. Shows how even features, that most folks would consider totally normal, well, they could be this huge source of anxiety for someone with BDD.
Right, right. And it's not even always about feeling unattractive in general.
That's such an important point. This isn't simply a matter of ugly or not ugly. This is about struggling to meet these, well, impossible standards, these impossible standards of perfection,
Mm-hmm.
symmetry. It can even get to the point where someone wants to change their racial features.
Okay, we're already getting into some serious territory here. And, for listeners who might be thinking, oh, this is just a woman's issue, that's another myth we need to debunk right away.
Absolutely.
Yeah.
Men experience BDD too.
Yeah.
And their focus areas, well, they're often different. The manual talks about how men frequently fixate on, penis size, for example.
Right.
And it highlights how these pressures, right, these societal pressures and these ideas about what's attractive, they play out so differently between genders.
It's also interesting, right? And here's another layer to this whole thing. BDD isn't even limited to what you see in the mirror. We're talking about all the senses.
Absolutely.
Mhm.
Some people with BDD, they obsess over how things feel to the touch, their smell. Some even fixate on how a body part feels internally.
Really?
There's this wild example in the manual, something called phantom bite. Basically,
Right.
you have people who are totally fixated on their dental occlusion.
Dental occlusion.
Yeah, like how their teeth bite together. They're convinced it's wrong, even if, a dentist tells them everything looks perfectly normal.
Wow. Imagine being so fixated on something that isn't even visible to other people. I mean, that just shows you how deep these perceptions can run.
It really does. It's amazing how much these thoughts, these perceptions can impact someone's life.
Absolutely.
And, that leads us to this question, right? If this is so deeply rooted in someone's mind, what happens when they try to address the physical, instead of the mental?
It's like if you try to put a Band-Aid on a broken bone, it's not really going to solve the problem, right?
Exactly.
So are we talking about like cosmetic surgery here?
We are. And that's actually something the manual goes into in detail. The whole complicated relationship between BDD and cosmetic procedures. It's understandable, right, that someone with BDD might think, hey, if I can just fix this one thing, I'll feel better.
Mm.
But the reality is, it's almost never that straightforward.
So you're saying cosmetic surgery, it's often not the answer for people with BDD?
It's a tricky one, because while some people might find some relief, the research is pretty clear, at least from what's presented in the manual.
Mhm.
The majority of BDD sufferers, they don't find lasting relief from procedures, and often their focus will just shift to another perceived flaw.
Oh, wow. So it's almost like a vicious cycle.
That's a good way to put it. They try to address one thing, but then another flaw pops up and so on. It really underscores that we're dealing with, a psychological condition here, not a simple desire to change appearance.
It's so much more than that.
Right. And the manual actually shares some, pretty startling statistics about this. A huge percentage, and I mean really significant, of BDDB patients end up dissatisfied after cosmetic surgery.
Really?
Yeah. And sometimes their symptoms, they even get worse. And it's heartbreaking because for some, this desperation for a fix, it can lead to really extreme behaviors. The manual actually talks about people attempting DIY surgeries
Wait, DIY surgeries? What do you mean?
at home on themselves. There's this one case in the manual about a man who tried to use staples, like office staples,
Oh my
to
God.
try and tighten the skin on his face.
That's just heartbreaking. It really shows you how much pain someone with BDD might be in.
It really does. And it shows how important it is to recognize these behaviors for what they are, signs of distress. not just vanity or something superficial.
Absolutely. These are cries for help.
Exactly. And that leads us to the big question, right? What's at the root of all of this? What leads someone to develop BDD?
Right, because it can't all be about, like, what someone sees in the mirror, can it?
Exactly. There's got to be more to it than that. And that's what we're going to unpack right after the break.
Yeah.
It's like, this fire alarm, right? It's going off in your brain, but instead of smoke or fire, it's these perceived flaws.
Hmm.
And just like you wouldn't ignore a fire alarm, you can't ignore BDD. Those symptoms are serious.
Wow. Yeah. That's a powerful way to put it. So when we talk about the brain being involved like this, I mean, what does treatment even look like? Is it just talk therapy or what?
That's a really good question, and something this manual actually gets into. A lot of detail, actually.
Right.
Because, yeah, therapy is important, definitely a key part. But we can't forget that BDD isn't just, like, all in your head.
Right, right.
But
It's not just a matter of thinking positive thoughts or something.
exactly. There's a real dialogical component there.
Uh-huh.
And because of that, treatment, well, it often goes beyond just talking.
Okay, I'm really curious about this. So, what kind of stuff are we talking about here? What might a therapist actually do to help someone with BDD?
Well, there's this one really interesting technique the manual describes. It's called imagery rescripting. Have you heard of that?
Imagery, no. I think so.
It's pretty fascinating, actually.
Mhm.
It involves having the patient, guiding them to revisit painful memories. But, and this is the interesting part, they don't just revisit them. They work on actually changing the narrative, of what happened.
Whoa, so they're basically rewriting their memories.
Kind of, yeah. It gives them a chance to process those old emotions, those experiences in a new way, and maybe even find some healing, some closure.
Wow, so powerful. But treatment obviously isn't just about the past, right? It's going to be about learning to see yourself differently in the present, too. So how do therapists help with that?
Well, some therapists actually get this, they use masks or even videos.
Masks.
Yeah. It's a way to kind of help the patient see themselves more objectively, that how other people see them. Because often there's this disconnect, right, between how someone with BDD sees themselves and reality.
Oh, wow. That's really interesting. It's like they can finally see themselves without that filter of BDD, right?
Yeah. It can be a really powerful experience for people. They start to realize, hey, maybe I don't look the way I think I do.
Yeah.
And from there, you can start to build a more, compassionate self-image, a more realistic one.
It's like holding up a mirror, right? And being like, look, this is the real you, and you're worthy. You deserve to be loved and accepted just as you are.
Exactly. And that's so key, right? That self-acceptance. But listen, it's important to remember, this isn't, a quick fix. It's a process.
It's a journey, for sure.
Right. And the manual really stresses how important it is for therapists to work with the patient, to figure out what works best for them. Because everyone is different. And everyone's journey with BDD is going to be different too.
It makes you wonder, though, even though we're talking about this clinical diagnosis, this whole idea of, not being happy with how you look, it's something so many people struggle with, right? BDD or not.
Well, absolutely. And that's one of the things I think is so interesting about all of this. BDD can teach us so much about body image in general, and how much our culture really influences how we see ourselves.
Yeah, it's like BDD takes those common insecurities, those things we all feel sometimes, and just kind of, turns the volume up to 10.
Yes, exactly. And the manual talks about this, how prevalent these unrealistic beauty standards are. And it makes sense, right? We're bombarded with these images of perfect bodies constantly. It's no wonder so many people struggle with their body image.
I mean, it starts from such a young age, too, It feels like you can't escape it.
No, you really can't. And it can be really tough, especially for certain groups, right? I mean, the manual specifically talks about how, women, people of color, LGBTQ plus individuals, they often face even more pressure to conform to these, like, totally impossible ideals.
Right, right. And that's something that's so important for everyone to keep in mind. These body image issues, they don't exist in a vacuum. They're connected to these larger cultural forces, these systems of power and bias.
100%. It's not just about how individuals see themselves. It's about how society teaches us to see ourselves and each other. And, that's where things get really interesting because Mignoli actually talks about how therapists need to keep all of this in mind, these larger societal factors when they're working with their patients.
So it's not enough to just focus on the individual's thoughts and feelings, right? You have to address the whole picture, the cultural context.
Exactly. It's
Yep.
about helping patients understand that their struggles They're not happening in isolation. They're connected to these larger forces.
So it's almost like a kind of like cultural critique too, right? Helping people see those connections.
That's a great way to put it. And honestly, that's what makes studying BDD so fascinating, I think. It really shows us in a really powerful way how powerful these cultural norms actually are, you know.
Yeah. And what a huge impact they can have.
Huge impact on our mental health, on our emotional well-being, on, our whole lives, really.
It makes you think, like, if these pressures are such a big part of the problem, how do we even begin to fix it? Can we really create a more body-positive culture? Where do we even start?
It's a big question, right?
Yeah.
And the answer, well, it's not simple. There's no easy fix for something like this, unfortunately. But the manual does offer some ideas, some ways that therapists can help patients start to challenge those beauty standards they've internalized.
Like, what kinds of things can help?
Well, we touched on one earlier, using those masks or videos, remember, to help people see themselves, through a different lens.
Right.
Because it can be really powerful to see yourself as others see you, to break down that distorted image and start to see yourself more realistically and more kindly.
It's like you're saying, hey, this is the reality. You don't have to fit into this tiny little box to be worthy.
Right.
Yeah.
Yes, exactly. Worth, it comes from within. It doesn't come from, fitting some arbitrary standard. The manual also talks about another technique. Cognitive restructuring it's called.
Cognitive restructuring. Okay, that sounds kind of intense. What is that?
Well, it's about recognizing those automatic negative thoughts, the ones that just pop into your head without you even realizing it. The ones that say, oh, you're not good enough, you're not this enough, you're not that enough.
Oh, wow. Yeah. We all have those thoughts sometime.
Everyone. And with BDD, those thoughts, they can be really loud. So with cognitive restructuring, you learn to identify those thoughts and challenge them, like hit the pause button.
So instead of thinking, ugh, my nose is huge, it's more like, okay, wait a minute, my nose is my nose.
Yes, exactly. And it doesn't define you, right? This is about replacing those critical thoughts with something more balanced, more true. And the cool thing is, this is a skill anyone can learn. You don't have to have BDD to benefit from it. We can all learn to be a little kinder to ourselves.
It's like, be your own best friend, right? Talk to yourself the way you talk to someone you love.
I love that. And that self-compassion, it's so important because healing our relationship with our bodies, it's a process. And the manual, it actually talks about this idea of self-acceptance when it brings up aesthetic sensitivity. Because people with BDD, they might actually be more aware of beauty. But sometimes that awareness, it gets stuck on perceived flaws.
So it's not about like getting rid of that appreciation for beauty. It's about expanding it, right?
Yes. Expanding it to include everything, all shapes, sizes, colors, ability.
That's what the body positivity movement is all about.
Right. Celebrating all bodies. But, this is bigger than just individuals, right? We need a real cultural shift here.
Totally. Because
Yeah.
you can't just tell people to think differently, right? Not when they're surrounded by these messages telling them they're not good enough.
Exactly. It's like we have to change the messages themselves.
We need more diversity in the media, you know, in advertising, everywhere.
Yes.
Yeah.
1,000,000 times yes. Because everyone deserves to feel seen and valued for who they are.
Exactly. And, we say imperfections, but honestly, those are often the things that make us interesting, the things that make us beautiful.
Couldn't agree more. Now, it's important, as we're talking about all of this, this body positivity and self-love, that we remember that BDD is a serious condition. And for some people, they need professional help. It's not as simple as just, like, loving yourself more.
Right. And the manual actually talks about that, how there's this stigma around BDD.
Oh, huge stigma.
Yeah.
And it prevents people from getting help.
It's like on top of everything else, people are afraid to even talk about it.
Absolutely. Because they think, oh, people will judge me. They'll think I'm vain,
Right.
And that's why we need to have these conversations more openly, more honestly. Talk about body image, talk about mental health, talk about BDD.
Because the more we talk about it, the less power it has, right?
100%.
Yes.
So if you're listening and you're struggling, please, please know that you're not alone.
Yeah, you are not alone.
And there is help out there. Don't be afraid to reach out.
This has been such an important conversation, really eye-opening. So as we wrap up here, what are some key takeaways for our listeners?
Well, I think the biggest one is that BDD, it's complex. It's not just about vanity. It's biological, it's psychological, it's societal.
And treatment, it can be tough, but recovery is possible.
Yes. Absolutely. And I think it's also been so interesting, to see how the themes of BDD connect to all of us in some way. Those beauty standards, that pressure to be perfect. We all feel that.
Absolutely. We've all been there.
So be kind to yourself.
Mhm.
Be kind to each other. And remember, there's so much more to life than how we look.
Couldn't have said it better myself. That's it for this deep dive. Thanks for joining us, everyone.
Thanks for having me.